Good afternoon, everybody. Good afternoon, everybody.
Good afternoon. Hey, yeah.
There you go. Appreciate that enthusiasm. Welcome to the July 20th meeting of the Rotary Club of Des Moines. Sorry to disappoint, I am not President Becky Greenwald. I'm President-elect Kevin Kusier, and Becky couldn't be here today as she had a business conference out of town. So I really appreciate the opportunity to handle the meeting today and stand up in front of a great looking group like you guys. I have been warned, since this is my first time up here, that there may be heckling involved. Not, I've said, okay, come on, bring it, just be nice, Bob. Okay, be nice. This is Rotary. We didn't have anybody sign up for the moment of inspiration today. So as a reminder, you can sign up in the lobby, you can sign up online, you can reach out to Kitty. We would really appreciate that. But I put some few thoughts together given our speaker today and tied into the healthcare, and that is that I think it's good for all of us to think about giving thanks in any way you choose to do that of all those involved in the healthcare profession. These are folks that are always there for us 24 hours a day, 365 days of the year, and they continue to do the good work of not only taking care of us, but figuring out better ways that will, and solutions that will care for us and the friends around us. So give those folks some thoughts in your own way. And now I'd like to ask you to stand, and we will recite the Pledge of Allegiance, the four-way test, and then greet everyone. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Is it the truth?
Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Is it fun?
Is it fun? Please greet fellow Rotarians. That's great, everybody. At this point, we're going to welcome three guests today. I will ask you to, as I introduce you, I ask you to stand and remain standing, and then we will recognize all three of you at one time. The first is Keisha Jones from the Armourdale, guest of the club. Welcome, Keisha. We have Cindy Snell from Waukee Apex, spouse of Mark Snell. And we have Joyce Wheeler, Waukee Rotarian, pharmacist, and the spouse of Todd Wheeler. Welcome, everybody. We have a birthday in the house today. We have a birthday for Ron Langston. Ron, happy birthday to you. And lastly, this is tumbler time. So we would ask those of you who don't have a green dollar sign, or maybe do, to put in a few dollars, maybe $5, for the good of the foundation that allows us to do great things around the community. And next, I will be introducing our Rotarian, Susan Juckin-Johnston, who will be introducing our great speaker today that I'm really excited about. And before I ask Susan to come up, have a little bit of news about Susan. A quick congratulations is in order, as she was recently honored by the Iowa Environmental Council for Lifetime Achievement in Advancing Water Quality. We'll have more about this in next week's newsletter, but we'd like to publicly recognize Susan for the great job she does for us, the community. We're just so thankful to have you. Congratulations.
Well, that means a lot to me, and I'm so glad it wasn't that other thing that I didn't want to have become public. I am Susan Judkins. It's really my honor to serve as the program chair for Rotary this year, and thanks to Jackie Norris for stepping up to serve as vice chair. I'm really excited to introduce today's speaker, but a reason that I wanted to do that today was also to just take a moment to remind everyone that the program committee is always working to bring the best speakers in front of you. We welcome your suggestions, and those come into a process to kind of help our top choices move to the top. So we will be hearing from one of those top choices today. Another role that we always need to play is identifying someone to take the role of introducing a speaker. It's never a hard thing to do the introductions, but it can be hard to find people to say yes. And so please, as we reach out to you, whether you're within the program committee or in another role, if you can take the time to say yes, I'm happy to work from a bio to introduce one of our great speakers. It will help everything continue to move smoothly. So with that said, it truly is a pleasure to introduce someone of whom I think so highly in Tony Coleman, who is the president and CEO of Broadlawns Medical Center. He was chosen unanimously by the Broadlawns board in 2021 to assume that role. And at the time, they said it was unanimous because they recognized his exceptional leadership, financial acumen, and dedication to the mission of Broadlawns. And I know that's true. I first reached out to Tony after hearing him answer a question at a business conference where he was asked, what would you have done differently during COVID-19, which was primarily being addressed before he came to Broadlawns. So his answer was related to a prior role with Kaiser Permanente in the San Bernardino area in California. And I'm hoping we might hear a little bit about that today, but he truly recognizes the culture needs of the people with whom he works and is very driven to work through an organization like Broadlawns to also address social inequities. So Tony grew up in California. He joined the Navy and had some tremendous experiences there. As he was getting his master's degree, he really became more focused on social inequity components of healthcare. And I know that I have heard him say that he chose to come to Broadlawns and Des Moines because he thought both the city and the organization were a place where he could start to get his arms around how to do some of those things. So there's much else I could tell you about his tremendous background, I'm hoping he will let some of that shine through in his speech today. So please join me in welcoming Tony Coleman.
Well, good afternoon, and thank you for that wonderful introduction. But there was one thing you got wrong. I came to Des Moines because of the weather. Much better than California. Actually, the weather's not bad. It's not bad. I think I still have the novelty of snow. I really like the snow, and I don't have to work in the snow. I don't have a job where I'm like out in the weather, so it's not bad. I really appreciate being here. There's really three reasons why my wife and I fell in love with Des Moines. I'll get into that a little bit later. But first I want to say it's an honor to be here. It's an honor to be before you. I don't typically like to speak publicly unless it's something that I feel very passionate about and something that I feel is worthwhile. And healthcare is one of those things. So for that, I will gladly speak to anyone who will listen. Healthcare and eliminating health disparities, pursuing health equity, achieving health justice, those are my passions. And so I chose to follow my passion, and it led me to Des Moines. So here I am. So I'm just going to take a few minutes and talk about Broadlawn's Medical Center, talk about the journey, talk about the gift that I was given in being offered the role, and where we plan to take the organization and the community in the future. So, a couple of things that I'll talk about. I'll go through our strategic plan, our 4 pillars to our strategic plan. And I'll talk about the social determinants of health, which are central to what we do. And then I'll talk a little bit about what we do in the community. So when you talk about the social determinants of health, we have a strategic plan that has 4 pillars. And I always think about these pillars kind of like Maslow's hierarchy of needs. You can't really get to one until you have secured the one below it. Those pillars are workforce, patient outcomes, affordability, and upstream community health. So if you'll notice, workforce is at the bottom of the pyramid because you can't do anything without the right people. So the workforce pillar at Broadlawn's Medical Center centers around recruiting and retaining the best and the brightest people to take care of the patients that we have the privilege to serve. Recruiting and retaining. It's a lot like dating and marriage, right? When I dated my wife, I was living in California and she was living in New Jersey. And I was so just googly-eyed by her. I flew across the country every couple of weeks just to take her on a date. And I convinced her, luckily, to marry me. But that's not where it ended. She decided to marry me, thankfully, but I couldn't stop wowing her. I couldn't stop convincing her that she made the right decision. So as we're married, I have to continue to sell the idea of marriage. I have to continue, as my mentor would say, you have to continue to polish the diamond. My wife is that diamond and I'm the polisher. That could mean any number of things. It could be getting her her favorite Chinese food, whatever it is, taking the dog for a walk when she doesn't feel like it, whatever that is. But in healthcare or in any industry, really, the workforce is the same way. Right now, we're in a situation where not only are more generations in the workforce at the same time, there are 5 generations that come to work at the same place every day. But not only that, and the interesting dynamic that causes, but a lot of people are still kind of burned by the pandemic. And some people just don't want to come to work. So it's not enough to just recruit people. You have to do what it takes to retain them. That's a whole nother ball of wax. So the workforce pillar focuses on recruiting and retaining. Once we recruit and we retain the absolute best that we can, then and only then will we have a shot at good patient outcomes. And that's the second pillar. And when I say patient outcomes, I'm talking about really 2 things. The quality of the care that we provide, the hands-on care that our nurses and our physicians provide, those touch points. And I'm also talking about the care experience. Care experience is how our patients and their families feel during their time with us. Care experience starts when you drive onto the campus. Can you find parking? When you get into the hospital, can you find where you're going? If you're lost, does someone from staff notice that, then stop and ask you where you're going, and stop what they're doing and take you where you're going, right? The care experience. But you can't have a good care experience and you can't have good quality outcomes if you don't have the right people, okay? So only when you have the right people, you're retaining the right people, you achieve the right amount of quality care experience, only then will you start to see affordability. It is amazing how many times tests are wasted in healthcare because we don't have the right quality. How many times a test has to be done over and the cost of that. You can't be affordable, you can't achieve affordable care until you have the right people in place, until you have the right quality outcomes, until everybody understands what it means to provide the right care experience. So those are the first three pillars, and those are inward-facing pillars. Those are pillars that happen inside the walls of the hospital or on the campus per se. But the fourth pillar, and my favorite pillar, is upstream community health. That is when we go into the community and we partner with organizations and we sit with the community, we sit with the people who are closest to the pain, and we find out what they need or what we can do to improve their health status, okay? There are 6 things that encompass the social determinants of health. This is a graphic from the Kaiser Family Foundation. It talks about those 6 things. Those are things that happen outside of the hospital that have a direct impact on how healthy you will be and how long you will live. When most people come to a hospital, it's for episodic care. That means that they have an accident and they need some care, or perhaps they have a heart attack and they need that episode of care. But the majority of health is derived outside of the hospital. It's derived by living in a safe and healthy neighborhood. It's derived by having a high degree of health literacy. You can come to the hospital and we say we treat you for some ailment and we give you medication. But if you don't know how to read that medication, or if you don't know how to take that medication, and you're not literate in terms of your health care, you'll end up right back in the hospital. And it's very sad to say, but more than anything, the #1 predictor of how long a person will live is their zip code. It's their zip code. Our hospital is situated in the poorest zip code in the county. I think it was that way on purpose, because those are the individuals that need help the most. So that's our mission, that's my passion. Some of the things that we're doing in the community, we have a lot to do, but just a couple of the things that we're doing in the community. We're opening a clinic in September, the Drake Clinic. The Drake neighborhood has been traditionally forgotten about in terms of access to healthcare. So we have a small clinic on the Drake campus where we serve the students. We serve them in primary health care, we serve them in mental health care, but there's a greater need. So we're opening a larger campus on September the 7th. It's on the corner of University and 31st. You're all welcome to come. We're having a grand opening at 4:30. We'd love to see you all there. But the purpose of that clinic is not only to serve more students on the Drake campus, but to serve the residents of the Drake community. Because that community, as I mentioned earlier, has been traditionally forgotten about in terms of their health care. We've also coined what we call health ambassadors, which are people that work at the organization and they volunteer their own time to go into the community, visit with individuals, elderly or individuals that maybe can't read, and talk to them about their health care. And so many other things that we're doing and so many other things that we plan to do. But what I wanted to really convey to this organization today about healthcare is how important it is and how it affects every person in this room. We cannot afford to just be concerned about our own health care, because Broadlawns is a public institution. That means that a portion of our revenue comes from the taxpayers of Polk County. So if you live in Polk County, if you own a home in Polk County, when you pay your tax bill, part of that comes off the top and it comes to the hospital. So I have a responsibility to make sure that we are good stewards of that taxpayer dollars. But the other part of this is, when we have individuals in this county that don't receive adequate health care, they're either gonna come to the hospital before and get preventive care and minimize that illness, or they're gonna wait to the very end stage until it's really, really bad, and they're gonna come through the emergency department, and that's where it costs the most amount of money. And who pays for that? The taxpayers of Polk County. So what I'm saying is that we're gonna face and we're gonna deal with the problems in our community, the health problems. We're gonna deal with it one way or another, one time or another, on the front end or the back end. My hope is that we can deal with it on the front end in a preventive way, which is why I talk about upstream community health and minimize sickness, thereby uplifting the health status of the community. So that is my spiel. One thing that I did want to say about Broad Lawns, and as Susan mentioned, I came from California following my passion. I'm very thankful for my military experience, because had I not been in the Navy, when the recruiter called me about a hospital in Des Moines, Iowa, I would have said no thank you, because I'd never been in Des Moines. Never been in Des Moines until I interviewed. But because of my experiences in the military, I had gone wherever Uncle Sam told me to go, and stayed however long he wanted me to stay. Now the blessing is that my wife and I were pleasantly surprised when we got here. We were pleasantly surprised by a couple different things. And these are the three things that helped us fall in love with Des Moines. Okay, so there's three things that happen. Or three things that happen that make us an Iowan. Because I am an Iowan, by the way. So the first thing that happened that made me an Iowan is that I survived an Iowa winter. But I should survive two now. Okay. The second thing that happened is that my wife and I visited or went to the Iowa State Fair 5 times last year. Okay. 5 times. My family came and we all went, and they're coming back this year, so we're going again. The third thing that happened that makes me an Iowan is that I rode in a combine. What? No, really. How many of you have rode in a combine? Okay, how many people have not rode in a combine? Okay. You see, I'm more Iowan than you. My wife and I fell in love with Iowa for a couple of different reasons. Number one, I have a buddy that I was stationed with in boot camp, and he's from West Burlington, Iowa. His name is Chad Etchison. And when I got here, I called Chad. Chad invited us to his house, so we went there for Thanksgiving, and then we went last year for the 4th of July. And as we were driving to West Burlington, my wife loves to drive, and I'm the navigator, and I mess with the radio. But as we were driving, I was really just overcome by the beauty and the nature of Iowa. Around the July 4th, around that time of year, when you drive on these back roads, you see cornfields and soybean fields as far as your eye can see. It appears limitless, infinite, how many cornfields you see. And at that time of the year, the corn stalks are this very deep, very beautiful emerald green. And it just brought me a sense of peace to make that drive. I didn't see that anywhere in California, especially not in Los Angeles. So there was something inherent about the nature and the beauty of Iowa that my wife and I enjoyed. The other thing that happened, that continues to happen, that caused my wife and I to fall in love with Iowa, is the people. People are so genuinely nice. When we arrived, I came 6 months before my wife did, and people used to say, "Oh, there's this thing called Iowa nice," and I didn't understand it. I thought it was Iowa nosy, because when I came, everybody was asking me, "How are you doing? Where are you living?" I said, "Oh, well, I live down Florida." It was actually in MLK, Florida. "Oh, well, where?" "Well, I live kind of on this." "Well, where? What number?" And I thought people were being nosy, because in California, you don't ask that level of detail. Right? But after a while, I realized that it was because people here in Iowa really just wanted to make sure that I was doing okay. They wanted to make sure that I was getting along okay, and they wanted to make sure that I was here to stay. I have never, ever felt that way before. And I was in the Navy for 20 years, and I've been to 37 countries, and I've moved 9 times. Been around the world 2 times, and I've never felt the love, the sincere love that I felt when I came here to Iowa. And so then when my wife came 6 months later, she felt the same thing. There was such a big group of people that really just enveloped her and wanted to make sure she was doing okay. And they wanted to make sure that she was happy, because if she's happy, then I'm happy, right? And it's true. So we love Iowa, and we are here to stay. And I thank each and every one of you. I thank the individuals in the community for the opportunity to serve. I always say, and I mean this with sincerity, healthcare is my ministry. That's my ministry. It's my passion. It's my ministry. It is what I was put on this earth to do. And it is a supreme privilege to be able to go to work every day and speak up or speak on behalf of people who either cannot or do not know how to speak for themselves. And I would be remiss if I didn't thank a gentleman by the name of Jody Jenner. I've never met him, but I heard that he was a member of this club. And so when I said earlier that I was handed a gift, what I meant was that the hospital that I was handed, or that I was given when I took this role, is a product of the work that Jody Jenner did under his leadership and the staff. And I cannot forget that, and I don't forget that. So if any of you ever see him, or if you ever talk to him, I heard that he retired and moved away, tell him that I sincerely thank him for what he did, because he gave me a gift that I can take to the next level, and that's what we're gonna do at Broadmont's Medical Center. So that concludes my speech. I will take any questions that you have. This is your chance to ask me anything you want to add, anything you've heard about Broadmont's over the past couple of years. Here's your chance to ask me, and I will completely answer. Yes?
Thanks, Tony, for being here. I was wondering if you could talk about the role that the Broadlands Foundation plays in the mission of the hospital.
Absolutely. So that was Ann. She asked if I could talk about the role that the foundation plays in the mission of Broadlands. So in healthcare, we have these massive gaps. There's a gap between what we need to do and the resources that we have to do it. And being a publicly funded hospital, those gaps persist. So what the foundation does is the foundation raises money to help close those gaps. I'll give you an example. We have noticed that underrepresented females suffer from late-stage breast cancer detection at a higher rate than other individuals. That means that they have a higher mortality, or they die at a higher rate, simply because their breast cancer isn't detected as soon as it could be, or as soon as it is in other groups of people. So we have a mammography suite at Broadmont's, and our mammography suite is fairly outdated. But I believe that everyone should receive the same level of care, regardless of their socioeconomic background and regardless of their ability to pay. So in our operating budget, we didn't have the funds to renovate a mammography suite and bring the state-of-the-art mammography care, stereotactic biopsy machine, to our hospital. We had a budget, but it just wouldn't cover everything that we needed to do. So we relied on the foundation, and the foundation raised money. They raised more than half of what we needed, or I'm sorry, we had half of the money and they raised the other half and then some, so that we can renovate mammography, so that every woman in Polk County, whether you have means or you don't, whether you have insurance or you don't, whether you're a refugee that's been in the country for 10 days or you're someone that's lived here your whole life, if you need breast cancer care or if you need a screening, you can come to Broadmont's and we will give you the state-of-the-art screening that you and every woman deserves. And that was in part due to the foundation. So that's one of the things that the foundation does. Thank you for that question. Yes, sir.
I'm old enough that back in the olden days, I survived mumps, measles, whooping cough, and polio, and my brother suffered permanent brain damage from measles. So I'm really disturbed about the anti-vax movement, and I was wondering what more could be done to encourage people to get vaccinated.
That's a great question. So the young man shared that he's disturbed, I think is the word you use, by the anti-vax movement. I mentioned a couple minutes ago that my ministry is healthcare. What I mean when I say that is that I don't care what your political preference is. I don't care who you love. I don't care where you came from. I want to help you get to where you're going. But when you come to the hospital, I want to be able to care for the whole person. So I think, unfortunately, and we were just having this conversation, and I'm not attempting to politicize this time, but we were just having this conversation about how when things become politicized, they're inherently divisive. And I'm not advocating for one side or the other. Believe me, I'm here talking about healthcare. But when you have a two-party system that is designed where in order for one to win, the other has to lose, that automatically takes the focus off of the people, the American people, and they're the ones that suffer. So when I talk about healthcare, I speak from a place of facts. I speak from a place of research, and I speak from a place of what is best for the patient, regardless of a political ideology. I just talk about the facts. Before I arrived here, I worked in California for Kaiser Permanente, and I had two hospitals. I was over all of the non-clinical departments for two hospitals in a county that spans 65 square miles. We were the fourth worst hit in terms of COVID in the nation. And so as I managed the non-clinical service lines, one of the departments that I had was the morgue, and another department that I had was supply department. And I remember, throughout COVID, I never worked from home. I never took a day off. I've been in the hospital every day, ever since, both hospitals. And I thank God that it never had COVID. Wasn't because I was smart or anything that I did. He was just looking out for me. That's how I feel about it. But I remember when COVID really hit me personally. I was in one of our hospitals and I was walking out the back loading dock. And at that point, we had 3 morgues, one in one hospital and 2 in the other hospital. And all of our morgues were overfilled. People were dying quicker than we could get them to the mortuary. And so what I did with my supply department, because we didn't have room, we bought 5 53-foot refrigerated trailers. And we put 3 of them at one hospital. We put 2 at the other hospital. And that's where we were storing the bodies. That's where we were storing people's loved ones. That's where we were storing people's husbands and people's wives and people's children. And I knew that we had these 53-foot trailers because I ordered them. And I knew where we asked them to be placed. And I knew that that was the morgue overflow. But the COVID epidemic did not hit me and it did not break me down until I walked out on the back loading dock. And I looked to my left and there was a gurney. And it had someone inside of it and it had their name on it. And when I read that name, I realized that it was somebody's aunt or somebody's mother. And it occurred to me that regardless of where you stand politically on COVID or on vaccines, people are dying every single day, and there's no coming back from that. So how could I use my voice, and how could I use my position to help people dodge death or stay alive or avoid getting COVID? And that's what I try to do. So as far as anti-vax rhetoric, I don't know except to have the approach of humanity and to start with the foundation that we all can agree on, which is that we're all human beings and we all deserve a good life. And just take it from there. That's all I have. That's all I try to do. Thank you for the question. Yes, sir.
Have you had the opportunity to have an hour or 2 conversation with Dr. Julius Connor?
I have not.
He was for about 50 years the head of the Polk County Public Health Facility on Carpenter, Martin Luther King. And he's a wealth of knowledge.
Would you repeat his name, please?
Dr. Julius Connor.
Connor, okay. Question was, did I have a chance to speak with the head of the Polk County Department of Health, Dr. Julius Connor? I have not, but I'm intrigued, and I will look him up. Do you know if he's still in town?
Yes, he is.
Perfect. Yes, sir. And then ma'am, and then sir.
Broadlawn is thought of as the Polk County or the county hospital. And I submit that it is more than that. It is excellent. Our former minister had heart surgery there and loved the place. I chose a doctor from there as my personal doctor. And I had a need, my hip was giving me huge problems. And the equipment that they had to deal with it was second to none. It was a live x-ray. And I was prepared to get a cortisone shot. And the man who did it gave a pain shot first, and then the cortisone shot. And I thought he was just getting ready. He told me he was finished. I did not feel a thing. So the equipment was second to none. The care is second to none. And your lead doctor there is my doctor. And it's a wonderful place for anybody at whatever you need. And Polk County in general is blessed by this wonderful facility and growing. Adding your 3rd floor or 2nd, whatever, to the building, I am, it's really high.
Well, thank you for saying that. I appreciate that. I think in our minds, any of us who've had children that have grown up, you can attest to this, in our minds things stay the same, but in reality they're changing every day. So what I learned was that 10 or 15 years ago, Broadlawn was the last resort. It was a place that you didn't go. But the reality is today, we have become a provider of first choice. We have individuals that are switching their doctors to Broadlawn's doctors because they want to come be a part of something special. So I appreciate you affirming that.
recently Broadlawn's purchased some land in, I believe, Johnston, and I was wondering if you could discuss what the plans are for that project.
Sure. So we purchased about 9 acres of land in Urbandale, but it all kind of runs together.
I know.
Yeah, it's Urbandale, but so we purchased that land to be a part of something called a total health experience. There's going to be a medical health park there. And so we bought land there to open a brain health and memory center so that we can combat dementia and Alzheimer's, which is growing in the state of Iowa and in the region. So on the plot of land that we bought, we're actually working with an architect now to design the building so that it'll meet the needs of the community. And so it'll offer really 3 things. It'll offer prevention and early detection. It'll offer caregiver support, because what a lot of people don't remember is that for the person that has Alzheimer's, there's a family member that's taking care of them, often without means and without education. And then the third thing that it's going to offer is regional education in the form of like an auditorium where we can talk about latest breakthroughs in Alzheimer's and dementia. So that's where we are now.
Thank you.
Thank you. Yes, sir.
I would commend the work of the selection committee and Providence, first of all. And I think
Thank you.
they made
You want to tell?
a good choice.
I'm gonna give you their numbers. You can.
And most of us who've been around for a while have seen the real gains that Broadbonds have made in the last 20, 30 years. And I just wish you well as you carry the baton for another lap of that improvement of such a vital part of Polk County.
Thank you. Thank you, sir. Sir, in the back.
Yes, sir, I want to echo what Arden said. I want to particularly do a shout out to 2 of your physicians, Amy Bingham and Patty Gallup. Amy was the doctor that delivered grandson. Abby was your pediatrician. So heads up there.
Yeah.
Second thing, you need to write on rag ride. That would really make you
I heard it's coming up.
And thirdly, this is really the crux of my comments. Where do you see Broadlawns going in the next 10 to 15 years?
Yeah, great question. So I will tell Dr. Bingham and Dr. Aller what you said. They are 2 of my favorite doctors. Don't tell the other doctors I said that. They were both in the Navy. We were actually stationed in Portsmouth at the same time when I was in the Navy. We didn't know each other, but they are phenomenal women, phenomenal leaders, phenomenal physicians. Where do I see Broadlawns going in 10 to 15 years? I'll make this kind of brief. So I believe in an integrated health system. And what I mean by that is when you integrate a health system, you have all 3 elements working at play and the patient is in the center. So those 3 elements are the hospital, which is the facility that we come to give and receive care. Then you have the medical group, which are the physicians that are dedicated to caring for people. And then you have the insurance element, which helps pay for it all. What I've seen in so many places that those 3 elements are disjointed, and each one of those elements has their own agenda, and the patient isn't necessarily in the center, and that's when the patient loses. But when you bring all those together, when you have an entity that provides the health insurance, that provides the facility, and that provides the physician, there is an incentive to keep the patient healthy, because not only does it look good financially, but the patient is healthy. I did that at Kaiser Permanente. That's the model of Kaiser Permanente, and it works well. I'd like to do that here. We have physicians. We employ about 96% of our physicians. That means that they have a contract and we pay them a salary. We just expect them to see the patients. We obviously own the facility with a couple of different clinics around town, but we rely on different insurance mechanisms. And what happens when you rely on different insurance mechanisms is that you lose sight of the total health of the patient. Because we may have a patient, right, that has a chronic cardiac condition, and we know about it when it comes to Broadlawns. But if one day they happen to go to Mercy, we don't know about it and we can't track that care. But if we have the insurance company that is providing insurance for that care, every time a bill is submitted for that person, then we'll know where they went and we'll know their vitals and we'll know their condition. So I would love for Broadlawns to be an integrated health system. I would love for us to start our own MCO. Are any managed care organizations in the room? Tell the truth. Okay, here's what I'll say about managed care organizations. We have 3 managed care organizations in the state of Iowa. One is called Amer Group, the other one's called Iowa Total Care, and the third one is called Molina. All three of those are contracted with the state of Iowa to provide care for Medicare and Medicaid. That is the state's expansion under the Affordable Care Act. All three of those companies are for-profit companies that are headquartered outside of Iowa. When you're a for-profit company, you are beholden to your shareholders and the dividends. So there's a margin that those companies make every year, otherwise they wouldn't be in business. But where does that margin go? It doesn't stay in the state. It doesn't go back into the community. It goes to the shareholders. If Broadlawns were able to have a nonprofit MCO and we were able to take care of our patients, that margin or whatever was left over, we could pour back into the facility, we could pour back into the community, we could pour back into our people, and we could reduce the amount that we rely on the tax levy and put money back into the pockets of Polk County residents. So in 10 to 15, really sooner than that, but in 10 to 15 years, I would love to see us start a nonprofit MCO and become an integrated health system so that we can really get our arms around the care of our residents. How am I on time? Okay, I have time for one more question. I see you two, but there's a pretty young lady back there. I'm gonna go with the beautiful woman.
Some of us have been around long enough to know when the SAM Center started and knew them, and mental health was not talked about as much then as we hear it every few minutes now. Is the SAM Center still the headquarters for your mental health services?
Yes, so she asked about the SAN Center. That is our inpatient behavioral health unit. We have 44 inpatient beds. At Broadlawns, we have 1/3 of the inpatient beds in the state of Iowa. So 44 of those beds. And those two units, one's a 30-bed unit, one's a 14-bed unit, they are full. They're full 99% of the time. The reason for that is because we treat short-term acute mental health illness. So we'll get you in, get you stable, get you some meds, maybe a 6 to 8 day stay, and then we transfer you either out with medication or we transfer you to long-term inpatient behavioral health. But the state has closed, or the long-term inpatient behavioral health hospitals in the state have closed. The last one closed last year in Greenwood, so there's nowhere for people to go with long-term mental health illness. We're actually competing for beds in the state of Missouri and in the state of Kansas, which causes people to stay on our unit longer. So yes, it is still the epicenter, is what I call it, of mental health. And I'm glad that mental health has been destigmatized, but we need to do more to help our citizens that suffer from mental health illness. I think that's my time. Thank you guys very much for allowing me time to share my passion. I'm open for any questions afterwards, or if you want to come to Broadlands for a tour, come on by. I'd be happy to show you around. Thank you.
Wow, Tony, thank you so much for taking your busy schedule and spending time with us. It was very, and we all can say it's very informative. We all leaving today, being smarter, thinking a bit differently, learning from you, and that's a great gift that you're leaving all of us. And please know that from all of us to you and your team, the work that you all do for not only the patients, but the whole community of the metro area, please thank them on our behalf. Now, as a token of our appreciation, we are donating a book to the Des Moines Library and become a part of the Rotary Rosie Reader Van.
That's right.
You ready? You guys are being nice to me. We donated $40,000 to the Des Moines Public Library to develop this van, and now we're putting books in there, one in honor of you. So, yep. Now we'll switch to upcoming meetings, and as those before me have always said, please consider bringing a guest to the club and learning as we did today. One of the great benefits of being a part of this club is participating in an event like this and learning and growing, and hopefully you can find a spot where you can bring someone that might be interested in one of these. So first one coming up next week, David Kilpatrick, the Executive Director of the Des Moines Playhouse. Next, our own famous or infamous Greg Edwards, the CEO of Catch Des Moines. And lastly, Kevin Foley, who heads up the Des Moines Airport. So we've got great opportunities to learn and grow with those speakers. Thank you for being here today. Guests, thank you for joining us. Love to have you back. Really appreciate you all being nice to me today. So make it a great day, make it a great week. We are adjourned.